Some local soldiers needing to lose weight turn to liposuction. Who's paying for it and what the Army's policy says.
From WDRB, Fox News at 10 starts now.
If you are a soldier and you need to go from before to after really fast to meet rate requirements, what do? Well, some local soldiers are getting liposuction. After an injury while at war in Iraq, 2 surgeries and limited exercise for several months, this local soldier stepped on a scale and realized he had gained 40 pounds. We'll call him Robert. He does not want people to know he went to a plastic surgeon and got liposuction.
There may be a type of bravado about being able to lose the weight through exercise. But in my case, I was injured. I had a time limitation.
4 months before the Army would test his body fat.
If I would have gotten a negative report, it would have been looked at when I came up for promotion.
Dr. Tom Haas took about 20 pounds and 6 inches off Robert's waistline and reduced his body fat by 7 percentage points.
These are young, healthy guys, and you know, they bounce back quickly. It's hard to hurt a soldier. They have a little lipo. You know, yes, they're a little bit sore, but they're done and they're gone and they're grateful.
Dr. Haas has done lipo on at least a dozen soldiers in just the last year or so. He never expected to encounter military personnel opting for such a weight loss alternative.
I had no idea. You know, I don't know how I would have known, but I had no idea.
The Army knows soldiers are getting the procedure done, but not all soldiers tell. And we asked the Army about whether soldiers are allowed to get liposuction. A public affairs officer told us in a statement he or she may, with the commander's permission, get that done by a civilian healthcare professional. It is not funded by the Army. Now, lipo can cost anywhere from a couple thousand to several $1,000s. In the case of these soldiers, insurance does not cover it. They pay out of pocket for the surgery and any treatment for complications.